Very glad to see a lot of familiar faces here, a lot of new friends I'm looking forward to meeting as well. And I think healthcare is an issue that concerns all of us. And even if it doesn't concern you now, because you may be young and be healthy, it's something that's going to concern you in the future as well. And I think it's for that reason that a lot of Singaporeans are concerned about the cost of healthcare in Singapore. There have been surveys done which show that up to 3/4 of Singaporeans are actually concerned about the cost of healthcare. And I would say there are two broad groups of Singaporeans who are really affected by the cost of healthcare and really concerned about it. One would be obviously the lowest income groups. But secondly, also those that are not necessarily considered, we would consider poor, but fall within in the lower middle income groups. And here's why I've observed that these two groups are affected. For the lowest income groups, obviously they are able to obtain assistance through things like Medifund. But Medifund, the government says that no Singaporean will go without healthcare because they cannot afford it. So they cite Medifund as something that's available for the lower income people. But Medifund, as you all know, is subject to very strict means testing. And usually takes into account not just your personal income, but also the income of your family members, and it looks at the housing type that you stay in. And the process of means testing very often deters many people from completing the whole application for assistance. And so it's easy for the government to say that there is assistance available, but if that assistance is not easily obtainable by people who really need it, that's where there's a problem for a lot of people. For example, one of the common roadblocks that many patients face when applying for assistance, for example Medifund, is difficulty in obtaining the proof of income from family members. Okay? And the second group will be the lower middle income. And they may not qualify for Medifund, but yet they don't have enough to cope with the large medical expenses that arise from major illnesses. And so this is why the surveys have shown that it's actually this lower middle income group which is actually the group that is the most concerned about the cost of medical expenses, more so even than the lowest income group. And of course, there are many things that cause this burden of healthcare in Singapore. First would be things like out-of-pocket payments. We have one of the highest out-of-pocket payment as a proportion of medical costs in the developed world. About 60% of our costs are paid out of pocket. 60% of medical costs in Singapore are paid out of pocket, compared to the average among high-income countries that are members of the World Health Organization. Only 14% is paid out of pocket. So clearly, we are a world leader in terms of out-of-pocket payments. And secondly, we have MediShield, which is the closest we have to a national health insurance scheme. But yet, the premiums of MediShield are very regressive, meaning that very often those that are lowest income are paying the highest amount in premiums. Because retirees, for example, pay more than 20 times what a young working adult would have to pay in terms of premiums. And in terms of proportion of the premium burden, the elderly contribute 36% of the total premiums of MediShield, and yet they make up just over 12% of policyholders. So they are paying a disproportionate amount into the MediShield pool. So I propose that the government should subsidize MediShield premiums for all vulnerable groups, including the elderly, those with no income, people with disabilities, and those who have exhausted their MediSave because of medical expenses. And these premium subsidies should be automatically extended to people in these groups without a need for them to apply separately. I also suggested in my adjournment motion speech 3 weeks ago that the government should introduce an annual cap in out-of-pocket payments made by each patient. So with the remainder of the bills being borne by the government. So this would contain the risk that ordinary Singaporeans face And this is actually it's not an unusual practice. It's a practice in most developed countries actually. So the government also needs to change some of its philosophical approaches to financing healthcare. And firstly, co-payments. Co-payments have their uses in mitigating overconsumption, but they should not be applied uniformly to all patients. Studies have shown that high co-payments often deter poor patients from seeking the necessary medical treatment, and they also reduce compliance to doctors' prescriptions. And both of these can cause a deterioration in health and result in even more expensive medical interventions later on. So you think that you are saving money by not by the government may be making people pay more in terms of co-payments, but in the end of the day, the government will have to expend more because these guys come to hospital and they have to stay in hospital. And secondly, I call for the automation of means testing in all healthcare institutions in order to minimize paperwork for patients. And third, we should look into pre-qualifying those from vulnerable groups for financial assistance so they don't need to go through that whole trouble of applying for assistance separately. So I won't go into all the other proposals I made and all my party proposals. I think I've run out of time. But I'd like to invite you to visit my blog. I posted my whole speech up there. And if you like, you can also give me your email address. I can send it to you. So I look forward to having a very engaging discussion with all of you later. Thank you.